Hello guys, it's Dominique here and I'm excited. Today we are going to be starting our series that I've been promising on how to apply and administer local anesthesia painlessly. So this is one of the most favorite things that I like to do as a dental hygienist is administer anesthesia. I do like to make sure my patients are comfortable as I'm applying anesthesia, and I have discovered ways that we can definitely apply it painlessly for a patient. So our first series is going to be a video on armamentarium, and that's just to properly set up that syringe. That is one of the most important steps to apply anesthesia and to apply it painlessly. Instruments needed are the syringe, our needles. The first one is a short needle, and I typically use a 30 gauge. The second one is a long needle, and that's used for our IA blocks and our lingual blocks. Third is the carpule of anesthetic. And our fourth thing that's most important is our protector shield, and this is to avoid needle sticks. Inspecting the carpule is a very important step when administering anesthesia. I always want to make sure that I have the correct drug of choice. Also, I want to check to make sure that the anesthetic is not expired and there's an expiration date on each carpule. I then check the rubber stopper to make sure that it is intact and not tampered with. And then one of the last things that I do is check the diaphragm to make sure that it is sterile. And you can use an ADA-approved disinfectant to clean off the diaphragm, but never alcohol. The next step I do is actually inspect the syringe itself to make sure, looking through the window, everything is clear, the harpoon and the piston are intact, and looking closely, everything does look like it's functioning properly. So it looks like we are ready to load the syringe. Next step is needle inspection, and here is a long and short needle. Typically at our office, we are all happy with using a 30 gauge needle, and I'm just going to show you the area where you can find the size of the diameter of the needle, and that is located right on the side. So as you can see here, this one is a 30 gauge needle. On the other side is the arrow that indicates where the location of the bevel is. Okay, we are ready to load the syringe, and I do start first with taking the carpule of anesthetic and placing it into the syringe barrel. And as you are doing so, you want to make sure that the serial number is not blocking your view as you are looking through the window. One important step as you are administering painless anesthesia is to be able to see the rubber stopper as you are depositing the medication. So you want to make sure that the view is clear. Next, I do push onto the harpoon to make sure that the piston is stuck into the rubber stopper, and you can use the finger grip to accomplish this. After I've loaded the carpule of the anesthetic into the barrel of the syringe, the next step is to attach the needle. So you want to go ahead and twist off the cap and use the needle adapter to attach the needle, and you're going to be twisting it onto the needle adapter, making sure that you are aware of where that indicating arrow is. So as you are twisting, you want to make sure that indicating arrow is opposite the window of the syringe. And you want to go ahead and twist until tightened. And when you are done twisting, that indicating arrow has to be opposite the window of the syringe. All right, so we are tight, and there is the window of the syringe. If you flip over the syringe, the indicating arrow is right there, and it is opposite the window of the syringe. A really important step if you want to accomplish painless anesthesia. Okay, we are ready now to attach the protector shield. Attaching the syringe to the protector shield is accomplished by just taking the tip of the cap of the needle and pushing it right through that hole. This is a really important step in protecting yourself from needle sticks as you are removing the cap of the needle from the syringe. And it also helps to protect yourself when you are dismantling the syringe and disposing the needle. Okay, we are now ready to perform the aspiration test, and you want to just remove the cap of the needle. And I'm going to try to zoom in so that you can see the tip of the needle and the bevel so that we can do the aspiration test. So the aspiration test is done by just slightly pushing onto the thumb ring of the syringe so that a small drop of liquid is seen. And then you want to aspirate by just pushing back on the thumb ring of the syringe so that the liquid goes back into the shaft of the needle. So I'm going to go ahead and zoom in and perform this several times, and this is an important step so that you can make sure that the syringe is ready so that we can do the aspiration test. To safely remove the cap of the needle, if you don't have a shield protector, you can just grab onto the cap of the needle and you push back and drop the cap onto the tray. And then you want to perform the aspirating test. And I want to go over this a little bit more with you so that you can see specifically how to perform this. Again, you just want that small little droplet of liquid to come out the tip of the needle. And you accomplish this by simply pushing slightly on the thumb ring. And to aspirate, you're going to bring your thumb back. And bringing your thumb back after you have pushed out the small drop of liquid is going to bring the liquid back into the shaft of the needle. And this is a really important step. After you have done your anesthetic deposit, to recap the needle, you don't want to use your hands to touch the cap at all. You are just going to take the tip of the needle, go to the open portion of the cap, insert, and when you have come in about halfway or a quarter or so, you can pick up the cap of the needle and tighten it.